Here's a number that's making healthcare investors jump for joy, and it might completely reshape how we think about Medicare in America. UnitedHealth Group just dropped some surprisingly optimistic news that sent shockwaves through Wall Street. The healthcare giant announced that roughly 78% of their members will be participating in premium-rated Medicare insurance programs come next year. A figure that's got everyone talking about what this really means for the future of senior healthcare. But here's where it gets really interesting and potentially controversial. When UnitedHealth revealed this projection on Tuesday, their stock price immediately surged by 3.21%, climbing to $330.52 per share. Why such excitement? Because when Medicare plans earn those coveted 4-star ratings or higher, the government essentially opens its wallet wider, providing substantially larger reimbursement payments to insurers. We're not talking pocket change here. These bonus payments can easily reach hundreds of millions, sometimes even billions of dollars. Now, here's the part most people miss. This 78% enrollment figure in top-tier Medicare Advantage plans isn't just a random number. UnitedHealth insists it aligns perfectly with their internal projections and matches their historical track record. The company based this forecast on preliminary data analysis. And according to at least 3 industry analysts, it's actually better than what many investors had been bracing themselves for. But wait, there's a major plot twist coming that could change everything. This announcement arrives just weeks before the Centers for Medicare and Medicaid Services releases their highly anticipated 2026 star ratings data, typically unveiled in October. These ratings don't just influence which plans seniors choose. They directly determine how much money the government pays insurers. And here's the kicker. These upcoming ratings will actually impact insurance company revenues in 2027, creating a ripple effect that extends far beyond next year. The market clearly liked what it heard. Elevance Health saw their shares climb 1.3% to $312.01. While Alignment Healthcare experienced an impressive 4.7% jump to $16.98 during early trading sessions. Let's address the elephant in the room that makes this whole situation controversial. Medicare Advantage has undeniably been the golden goose for health insurance companies, driving substantial growth across the industry. Yet simultaneously, these same insurers are getting squeezed from multiple directions, escalating medical expenses on one side and increasingly stringent government reimbursement policies on the other. This creates a fascinating paradox. The very program generating their biggest profits is also becoming their most significant challenge. As J.P. Morgan analyst Lisa Gill pointed out, virtually every insurance company is desperately trying to improve their profit margins, making star ratings a make-or-break factor that could completely derail their financial strategies. And this is where UnitedHealth's timing becomes particularly intriguing. Some might even say suspicious. The company has scheduled meetings with investors and analysts this week, where they're expected to reaffirm their 2025 adjusted profit forecasts. Remember, back in July, UnitedHealth projected full-year adjusted earnings of at least $16 per share, but only after they had suspended their previous outlook in May due to mounting pressures. Here's what makes the situation even more complex. UnitedHealth isn't just dealing with typical business challenges. The company is currently navigating high operational costs while simultaneously facing federal investigations. They're essentially fighting a two-front war, trying to maintain profitability while rebuilding investor confidence that has been shaken by these ongoing scrutinies. So here's the million-dollar question that nobody's asking out loud. Is UnitedHealth's optimistic 78% projection a genuine reflection of their Medicare program quality? Or is it a carefully timed announcement designed to boost investor confidence before those crucial October star ratings are revealed? Think about it. If you're a UnitedHealth shareholder, are you celebrating this news as proof of the company's resilience? Or are you wondering what challenges might be lurking beneath these seemingly positive numbers? And if you're a Medicare beneficiary, does this make you feel more confident about your plan options? Or does it raise concerns about whether insurers are prioritizing profits over patient care? What's your take on this Medicare Advantage surge? Do you think UnitedHealth's projections represent genuine improvement in healthcare quality? Or are we witnessing a masterful example of corporate damage control? Share your thoughts, because this debate is far from over, and the October star ratings release will either validate UnitedHealth's optimism or expose some uncomfortable truths about the Medicare system we all depend on.